Picture this, your child is having a blast on the soccer field and then, bam, they're clutching their knee in pain. It's a sight no parent wants to see. Knee injuries in children's sports are more common than you might think. From Little League baseball to weekend soccer games, the risk is always there. But don't start hyperventilating just yet. The key is to stay calm, but not dismissive. You see, kids may be resilient, but they're not invincible, and they certainly don't lie about pain. When your child takes a tumble and their knee takes the brunt of it, it's important to take it seriously. While not every fall results in a significant injury, it's essential to remember that early intervention can prevent further damage and complications. So, don't panic. But don't brush it off either. Now that we've set the stage, let's delve deeper into the most common knee injuries your child might encounter on the field. Your child might be a future Messi or Serena Williams, but they're not immune to knee injuries. So, what are these injuries we're talking about? Let's address the pesky sprains first. Now imagine the knee as a hinge. If the hinge is forced to move in a way it's not supposed to, you get a sprain. It's a stretch or tear in a ligament, the tough bands of fibrous tissue that connect the bones in the knee. Next, we have strains. They're like sprain's annoying sibling. A strain is a stretch or tear in a muscle or tendon. In the knee, the quadriceps and hamstring muscles are the usual culprits. Then there are fractures, the break, chip, or crack in a bone. In the knee, the kneecap, lower part of the femur or upper part of the tibia or fibula can be fractured. It's like a crack in your favorite porcelain vase, except it's way more painful and way less replaceable. Now let's talk about dislocation. This is not about moving houses, no. A dislocation is when the bones of the knee are out of place, either completely or partially. It's as if the hinge we talked about earlier is unhinged, quite literally. Lastly, and probably most famously, we have the ACL tear. The anterior cruciate ligament, or ACL, is one of the major ligaments in the knee. It keeps your shin bone in place. A tear in this ligament is like a snap in an elastic band. It's painful and it can seriously affect stability. And there you have it, a brief rundown of the most common knee injuries kids can suffer in sports. Sprains, strains, fractures, dislocations, and ACL tears. They may sound scary, but remember, these are common injuries. The chances are your child will experience at least one of them if they're active in sports. Now that we know what these injuries are, what should you as a parent do when they occur? Knee injury in sports? It's not the end of the world, trust me, but it does require prompt and proper care. Let's walk through handling some of the common knee injuries we've discussed. First up, sprains and strains. If your child's knee is tender and swollen, it's likely a sprain or strain. Here's what to do. Start with rest, ice, compression, and elevation. The good old Rice method. This helps to reduce swelling and pain. Don't let your little athlete rush back into the game. Rest is crucial for healing. Next, we have knee dislocation. If your child can't move their knee or it looks out of place, we're probably dealing with a dislocation. This is a situation that requires immediate medical attention. While waiting for help, try to keep your child comfortable and avoid moving the knee. Then, there's the meniscus tear. This can be a tricky one, as it might not hurt much at first, but can get worse over time. If your child complains of a popping sensation in their knee or has trouble straightening it, it may be a meniscus tear. Rest and ice can help initially, but you should consult with a healthcare provider for a proper diagnosis and treatment plan. Lastly, let's talk about the dreaded ACL tear. This injury often comes with a loud pop and immediate pain. Your child may not be able to put weight on the affected leg. This is a serious injury that needs immediate medical attention. But here's the thing. Kids are resilient. With the right care and a little patience, they can bounce back from these injuries. It's important not to panic, but also not to ignore these injuries. Kids don't lie about this stuff. If they say they're hurt, so keep an eye out, be ready to give first aid when necessary, and don't hesitate to seek professional help when it's needed. And remember, it's not just about quick recovery, it's also about ensuring their future health and ability to enjoy sports. But remember, these are just general guidelines. Nothing beats professional medical advice. We've talked about knee injuries and how to handle them, but wouldn't it be great if we could prevent them in the first place? Indeed, prevention is truly better than cure. It's like putting on sunscreen before a day at the beach, or making sure you've got an umbrella before it starts to rain. Let's talk about some preventative measures that can help keep kids' knees in tip-top shape. First off, warming up. This is as crucial as tying shoelaces. It's all about getting the body ready for action, getting the blood flowing and loosening up those muscles. Next, protective gear. Imagine a knight going into battle without armor. Unthinkable, right? Same goes for sports. Knee pads can be a real game changer when it comes to preventing injuries. Lastly, let's not forget the importance of moderation. Kids can be full of boundless energy, but overdoing it can lead to injuries. It's all about finding that sweet spot between effort and rest. Remember, sports should be fun, not a one-way ticket to the hospital. So there you have it, a crash course on knee injuries in kids' sports. We've covered everything from the common injuries that can occur, to the best ways to handle these situations, and importantly, how prevention is often the best cure. Remember, it's not about wrapping our children in cotton wool, but rather equipping them with knowledge and skills to stay safe while they enjoy their favorite sports. Yet when injuries do occur, it's crucial to not panic. Our little athletes are tougher than they look, but also don't ignore it. Kids don't lie about pain. They're not in the business of faking a limp for attention. Always, and I mean always, consult with a doctor or a qualified healthcare provider. They are the experts who can provide the appropriate treatment and advice. If you found this video helpful, don't forget to share it with other parents. Hit that like button, subscribe for more, and ring the bell to stay updated. Remember, in sports and in life, safety first.